great, because then we can address a lot of the gaps that we need to address.
Thank you. It's great to see everybody starting to get to know each other and having old friends say hello once again. We will have people trickling in over the next few minutes. I know some people are out in the hall doing calls and that sort of thing. But I wanted to just thank Rand in particular for hosting us here today, and thank Alan Fremont, our longest right care leader, for making the huge effort to be with us, and bless you, Alan. We're just so lucky to have Dr. Alan Fremont, MD, PhD, our leader of our technical expert group, leading the way on data and driving us to achieve through data things that he had to convince me long ago that it was through data that we would save lives. And in fact, I think this man is largely responsible for 3,826 fewer acute myocardial infarction hospitalizations. And he's a true earth angel, and we're so delighted he's with us. So with that, I'll give you the mic.
Thank you, Hattie, for the very, very nice intro and so forth. I just wanted to say, welcome to all of you who I've seen many of you before here, but there's some new faces, and I'm not always here as well. But we've all got very busy schedules and a lot of commitments, and these types of meetings are, it takes a little bit to actually get there, and I really appreciate you showing up. And this particular meeting continues to show potential to really do some of the kinds of things we've seen in other regions, in San Diego and now in Northern California, so anything we can do to support that through some of the RAND investigators, or just hosting you here, or just if you have projects that you think are projects that your organization is interested in doing, and you want some researcher involvement, please let Chloe or I or Hattie know, and we'll see if we can help accommodate you. But with that, welcome, and we have some excellent speakers today, and Hattie's going to go ahead and introduce those.
Thank you, Alan. So we are very fortunate to have a new face here with us, a few new faces with us around this topic of diabetes in Los Angeles today. I want to say a special welcome to Donna Lieberman, who has come to us through Dr. Tony Kuo from LA County Public Health. Donna Lieberman is with the American Diabetes Association affiliate in Los Angeles, and we're just thrilled to have her meeting us for the first time here.
Thank you for inviting me. Thank you. I'm honored to be here.
Great that you could carve it into your schedule. So I want to keep us on time today because we do have a packed, wonderful agenda. And our first speaker today is the County Diabetes Coordinator, Jennifer Torres Mosst, PhD, who leads the Coalition for Diabetes for the County of Los Angeles. Dr. Torres is part of the CDC effort to spread diabetes best practices across the country, and she's the lead for Los Angeles. So Jennifer, could you please join us? Thank you. And Megan Olson, thank you for all the logistics here.
afternoon, everyone. Can you hear me okay? Okay, great, thank you. It's a pleasure to be here today. I'm excited to be part of the agenda today and to get to know a lot of you folks that have been doing such great work around diabetes and prevention and management. And today I'm just going to talk a little bit about our efforts at the Los Angeles County Department of Public Health to reduce the prevalence of diabetes. I'm going to particularly focus on our efforts around scaling some CDC initiatives. We've received funding from the CDC back in 2014 and just received continuation funds to continue this work. So most of my work is going to focus on those particular efforts, but I'm happy to answer any questions on other activities that the county may be doing. I have no financial relationships with commercial interests. So as I mentioned, I'm just going to talk a little bit about the work that we're doing in Los Angeles County to reduce the burden of diabetes in the county. I'll talk a little bit about some of the activities that we've been working on to scale up diabetes prevention and management programs. Talk a little bit about what we're doing to build capacity and sustainability of these programs in the region. And lastly, I'll talk a little bit about some of the evaluation efforts that we have been working on to evaluate our efforts over the last 5 years. So as many of you know, Los Angeles is one of the most populous counties with over 10.3 million people living in our county. Making it bigger than over 42 states. We are the third largest metropolitan economy in the world and one of the most ethnically diverse. However, being as populous as diverse as we are does present several issues, especially when it comes to being able to address public health concerns in the region. Nearly half of all of Californians are on the path to diabetes. Nationally, 1 in 3 adults are estimated to have prediabetes. And between 1999 and 2000, the prevalence of prediabetes among individuals in the U.S. has increased from 29% to 36%. In California, there are more than 13 million adults estimated to have prediabetes or undiagnosed diabetes. So altogether, we're looking at about 15.5 million people that have prediabetes or diabetes in the state. And in Los Angeles alone, 44% of those individuals are estimated to have prediabetes. And the prevalence is high across most regions in the county and increases with age. And it disproportionately affects certain racial and ethnic groups. And without interventions, up to 30% of people with prediabetes will develop type 2 diabetes within 5 years, and up to 70% will develop diabetes in their lifetime.
Could you just repeat that statistic? You said 30% who have prediabetes will go on to get full-blown diabetes?
Yes.
Thank you.
And so I wanted to really show the scope of what diabetes looks like in our county. The first map on the top, the blue one, is data that we've collected from hospitals to show folks that have been diagnosed with diabetes. And the bottom map is through our LA County survey, where we have asked individuals if they've ever been diagnosed with diabetes. So as you can see, there are more people going in for actual diagnosis than people that know they have diabetes or prediabetes. And as I said before, this does disproportionately affect many of our communities. And if you notice from these maps, there are certain communities that are significantly affected by diabetes. You know, and a lot plays into those various aspects, such as having food deserts, space for physical activity, and so those are some of the things that we're trying to address at the Department of Public Health. And diabetes, of course, is also expensive. Current trends in diabetes and prediabetes are troubling because of the associated human and financial costs. Not only do these conditions increase the risk of serious medical complications, but they're also extremely costly to families, businesses, healthcare plans, and of course, government. As the slide indicates, in Los Angeles alone, it is anticipated that the cost of treating diabetes will be approximately $5 billion in 2015 and continues to grow. To curb some of this cost and ameliorate the issues of diabetes, there are significant investments being made both locally and nationally to really target some of our communities. So now I'm going to talk a little bit about our efforts within the county to reduce the prevalence of diabetes. Back in 2014, the Los Angeles County Department of Public Health received a cooperative agreement from the Centers for Disease Control and Prevention. This particular cooperative agreement, known as 1422, because the CDC tends to number their grants, and so we just speak in that jargon. So the 1422 grant, which started in 2014 and ended in September of 2018, was our first really opportunity to try and to develop some key strategies to address diabetes and other chronic diseases. This particular grant had 18 different strategies, of which my focus was mainly on scaling the National Diabetes Prevention Program, so it was really prevention driven. But some of the work that we did through this grant, among the 18 different strategies, including developing shared use agreements between school and communities, increasing healthy food options through food procurement policies at various hospitals, and working with different employers, working to develop community plans to promote active transportation through our PLACE program, scaling the National Diabetes Prevention Program, and working with some of our health systems to develop team-based approaches and medication therapy management programs for those patients with untreated or undiagnosed hypertension. In September of 2018, we received another grant from the CDC. Very similar, but this time we're really focused on more policy system strategies, where we're really working more with health systems to integrate these various policies that we worked through in the other grant, which was 1422. And so currently we're working with many health systems, particularly our Department of Health Services, to integrate some of these practices that we started in 1422, implement some EHR measures, work on some pharmacy strategies to improve clinical community linkages to some of these programs, and also really thinking about working with some of our health system partners to have a full spectrum of care when it comes to diabetes, so that when patient goes to their provider, they're able to get either prevention services or management services. So trying to identify potential pilot sites to provide that full spectrum of care. I don't know how familiar many of you are with these programs, but I'll tell you a little bit about the two programs that we're working to scale up as part of these grants. The first one is the National Diabetes Prevention Program, which, if many of you are familiar with this program, it is a one-year lifestyle change program. This particular program helps participants to make behavior changes, such as healthy eating, increasing physical activities, and addressing problem-solving skills. The curriculum is 1 year, and it's broken up into two parts. The first part is weekly sessions for 16 weeks, where the individual is really learning the core curriculums and learning those lifestyle modifications. And the second part, which comes right after, and it really depends on the provider. It's either monthly or bi-monthly sessions where you are maintaining the changes that you made in the first 16 weeks. And so you meet one-on-one with your lifestyle coach and continue to navigate the process. Evidence suggests that participants that are able to fully complete the program may lose up to 7% of their body weight. through this program. The second program that we're working to scale up in Los Angeles is the Diabetes Self-Management Education Program. This particular program helps participants to manage their diabetes and related conditions. The program can be offered individually or in a group setting, and oftentimes it is facilitated by a certified diabetes health educator, and it really gives the individual the tools and resources to be able to develop better, healthier eating habits, incorporate physical activity into their daily lives, monitor their blood sugar levels, maintain good medication management, provides emotional and well-being support, and reduces the risk of other health outcomes. And so for the first grant that we just wrapped up, we weren't providing any diabetes self-management programs, but now with the second grant that we're working on, we're going to be scaling up both of the programs. And so as part of the work for these particular grants, we've really been working to focus on 4 particular areas, which is increasing coverage among public payers for these programs. When we started our work back in 2014, there was limited coverage for the National Diabetes Prevention Program. There was only one commercial health plan at the time that was offering coverage for the program. And since the inception of the grant, we're now looking at about 10 commercial health plans that are covering the program. We have Medicare who will be covering the program, and as of January 1st, 2019, in California, Medi-Cal is going to be covering this program as well. So we've really come a long way from 2014 where there was limited coverage, and this really gives us an opportunity to really get people into these programs, because what we saw in the early days when we were scaling this program is that without this coverage option, it was going to make it difficult to get people to take part in these programs. We've also been working with organizations throughout Los Angeles County to increase the supply and the quality of these programs. Again, when we started this work in 2014, there was about 17 national diabetes prevention programs. To date, we have over 62 national diabetes prevention programs at over 103 sites in the county. We still have a long way to go because they are very centralized within our cities, and there are a lot of gaps, which you'll see in my next slides, that we need to address. And so the 1422 grant was limited to only city. LA City, and this time, this 1817 grant, we're able to cover the county. So we're going to make significant inroads in being able to increase the supply and quality of this program. We're working to increase referrals from healthcare providers because this is where individuals are identified. Working with our healthcare providers is very essential to be able to identify individuals and refer them to the proper programs. And of course, increasing demand and prevention. Increasing the demand for these programs among the at-risk population. And so that's really working with our community-based partners and working with folks on the ground to get that information out there about the programs. So what are we doing to scale the program? First thing is that, as I mentioned, there's been significant growth in these programs in Los Angeles County. So as a county, we track every single program that comes on the CDC registry, whether it is Diabetes Self-Management Education Program or the National Diabetes Prevention Program. And the reason we track that is so that we can create a proper mechanism for referrals, for providers, for community-based organizations. We get a lot of calls from folks that say, I may have diabetes, I have pre-diabetes, where do I go? And so we have created a repository of these programs. So we quarterly, we check the CDC websites to see if there are any new programs that have come up or any programs that have are no longer available. And we develop a comprehensive tracking tool which tells us where the programs are, who the contact person is, are they currently accepting new individuals, is this an insurance-based program, what is the cost associated, is it free, is there a sliding fee scale? So we get all of the information so that we're not referring individuals into programs that they cannot afford. And here is, pretty much a map that shows where a lot of these DPP, DSME programs are. As you can see, there are a growing number of national diabetes prevention programs and a few diabetes self-management programs. But then you have half of the county that's not even covered. And so what we're hoping to do with this next grant is to be able to get additional programs in those areas. We also established the Los Angeles Diabetes Coalition in 2014. This coalition is a group of key stakeholders in Los Angeles County who have been working on scaling these types of programs. And so we have members from health systems, community-based organizations, we have diabetes providers, academic partners, health sectors, and many of the health plans. We meet quarterly, and really just a lot of the work that we do is to really encourage folks to give us what is happening on the ground and how can we help you to scale this program up. And so over the last 4 years, we've developed subcommittees that are really targeted at addressing some of these needs of our members. Those 3 subcommittees include outreach and education, so how do we get that information out there? And we have referral systems and protocols, which is really where all of our health partners are part of to help us to develop pathways and protocols to help with identifying individuals and getting them into these programs. And then our partnership and access group is really focused on working with a lot of our health plans and funders to ensure that the folks that are doing this work have access to dollars to be able to scale and sustain these programs over time. The coalition has hosted about 4 symposiums, and these symposiums bring together key stakeholders both locally and nationally to talk about what is happening in diabetes care, not just here locally, but also nationally, and how can folks here locally be able to access information that from other jurisdictions that may be doing similar work. We've been working to build community partnerships with faith-based organizations and other CBOs to help them to develop such programs and outreach into their communities. We've been working with employers to help them build the case for coverage, so working with their health plans to be able to offer this program to their employees. We've connected many of the national DPP providers to payers and health systems so they can develop relationships to be able to attract individuals into their program. We convene local health plans to understand what does it take to get to build the case for coverage for this. And we've worked with a lot of the third-party administrators that are working with a lot of these CBOs and health systems as a biller, because many of these small CBOs they may be offering this program, but they never had the infrastructure in place to be able to bill. And so working with these third-party payers helps them to establish that infrastructure to be able to bill Medicare and Medicaid and all of those other entities that they may have never worked with before. We've implemented a demonstration coverage site to test various different payment models that payers can use. We're working right now with various health systems to see about coupling prevention and management programs to provide that full spectrum of care. So I just wanted to provide some examples of some resources that we've developed to build capacity and program sustainability for some of these prevention and management programs. Over the last 5 years, we have worked one-on-one with many of the providers to provide them tailored technical assistance around becoming accredited entities. The CDC requires that, and in order for you to bill for Medicare and Medicaid, that you are an accredited program with them. And so we've worked with a lot of these agencies to receive that preliminary status in order to be able to bill. And we're going to be working with a lot of the organizations that are interested in becoming AADE or ADA accredited and providing some funding for them to be able to do that. We've provided free trainings for people that are interested in becoming lifestyle coaches or master trainers. The lifestyle coaches are those individuals that are actually administrating the National Diabetes Prevention Program, and the master trainers are those who are able to train these lifestyle coaches. And so the reason that we did the master training was because we wanted to create sustainability. So if folks have individuals within their organizations that can continually train lifestyle coaches, they're able to grow their program. And so that's why we trained some master trainers. In addition, as I mentioned, we're working on the accreditation process. We've created some protocols and pathways to help improve screening tests and referral systems. And we developed some resources, especially toolkits, to help individuals who may be interested in starting a national diabetes prevention program from the ground up. And so we created what we like to call a choose your own adventure resource guide. So let's say you've been doing this program for a really long time, but now you're trying to develop the infrastructure for billing. You can go to a particular section of this book, and it will help you, it will walk you through how to set up the billing infrastructure for your organization. If you've never had this program and you're just literally starting from the ground up, you can go to the very beginning of this resource toolkit, and it will walk you step by step. And then of course, all our contact information is there so we can help you through that process. But it's just like a resource that a lot of our DPP providers said would be useful had they had this tool before. And so we tried to develop something that would meet that demand. We've also created some online resources, some that already existed and some that are new. We partnered with our Office of Women's Health Hotline to be able to do screening and referrals to the National Diabetes Prevention Program, and we'll be doing something similar for diabetes management work. So when individuals call the Office of Women's Hotline, let's say they're looking for housing services, or maybe they're looking for food pantries, that individual is also able to be screened at that time when they come in for pre-diabetes, and right there referred to a program of their choice. We have been able to put in all of the national DPP programs into the California Healthier Living website. So if you go to the website, you're also able to see where there's diabetes prevention programs in the region. And we work with 211 in partnership with Ultimate Health Corporation to develop an online diabetes and pre-diabetes resource of all the various resources that may be out in the community. And we also partnered with our Department of Health Services to develop the 1 Degree portal, which is very similar to the 211 portal, where you can go and do the screener for the diabetes prevention program or other screeners, and they can refer you to the program. And as a provider, you can also create case files. So let's say you are a DPP provider, you can actually create a case file so you can track and see if the individual has gone into the program and track of their progress. Here are some examples of some of the protocols that were developed by our screen, test, and refer group with our coalition. These were done in partnership with some of our coalition members and can be tailored for helping to improve identification and referral for the National Diabetes Prevention Program, and all of these resources are available on our toolkit, which is available electronically and in hard copy at our offices. We've also published several reports. We did some strategic planning around how we're going to scale this program, and also released a white paper in May of 2016, which really focused on how to build that case for coverage for the program in California. And we released a paper on establishing a framework for implementing the National Diabetes Prevention Program in Los Angeles County, which really walks individuals through our process for how we've implemented this program, and gives a framework that could potentially be replicated in other jurisdictions. And we did an RX for prevention through